Hi, my name is Olivier Drouin, and I am the founder of Covid Ecoles Quebec website. Hello.
How are you?
I'm doing great, thank you.
So thank you for taking the time to talk to me. I'm doing interviews with all of the people that will likely be put into like our pool of finalists.
Okay.
I also kind of dig in a little bit to all the submissions that we get to make sure they're not, COVID truthers or something like that, which you would be surprised how many people we get. They're like, masks don't work and lockdowns don't work and kids don't get it and crazy stuff. And so, obviously those people move aside, but for the potential like finalist pool, we definitely want to talk to everybody and get kind of their perspective on their work and what it means to them. And I have a few like cut and dry questions that are going to seem kind of lame, but we have to have everybody answer like the same questions, so we can put it into a montage and all that stuff. But first I wanted to ask you about the trends that you're seeing in schools, because I'm sure I co-founded the COVID Monitor, which tracks cases in K-12 schools across the United States. And so every single day I update that data system and see, where trends are increasing or where they're stabilizing or possibly, mitigation measures might have been put in place to help. And I too noticed that actually starting in December that primary education was increasing proportionally as a greater share of cases. So in the United States, most of our cases were in the high school, which for us is just grades 9, 10, 11, 12. And the teacher rate was highest in primary school, which here is just 1 through 5. And we have middle school that is, 6, 7, 8, which is weird. But I did notice that in December, I started seeing a larger share of the cases that were coming from primary school. And I wanted to ask you, is that something you're seeing? Are you seeing it more in some places than others? Just kind of get your idea of what's going on.
What we definitely are seeing that for sure. And what we saw before December versus now, before December, there was more schools with COVID, but not necessarily a lot of outbreaks. Now, almost every school becomes an outbreak. So not just a single case or a contained case, but it becomes large outbreak. And we had 3 schools in Montreal with variant cases, which become exponential in a few days. So they had to close the schools down. And most of them actually are elementary schools, yes. So we did not see that much before December, but we're seeing the same trend, and that's the trend in the UK and everywhere else in the world where variants were found. And I know Florida, you're the same situation. I think you have over 400 cases of B117 variant. We have 236 as of this morning, just in the province of Quebec, not in Canada as a whole. I think we have 700 in Canada, and just us in Quebec, we have over 236.
Yeah, we don't know how much sequencing individual states are doing to detect variants here in the United States. The federal government reports out, like the CDC here, as to how many variant cases have been detected, but Florida as a state is not releasing any data at all about how much testing they're doing for it, how much they found. We have to find it out from somebody else. But yes, Florida has had more of the variant cases than any other state. We also opened Sesame for schools since last August, and it's been rather unfortunate. Now they're up past 70,000 cases in Florida schools, and I haven't seen it dropping off in the high school cases, just a larger increase within the elementary cases, which isn't good. Which is a little strange to me because, as I understood it, the B117 variant is more capable of attaching. So basically, the mutation that occurred is that the spike protein is easier to attach and kind of levels the playing field between adults and young children.
Yep.
But if middle and high school students were not as they weren't able to transmit or to, become sick as often as adults, then we should be seeing the same spikes in high school kids, but we don't, which could mean that this entire time we were underestimating how infectious and transmissible high school students could be. But
well, and I think in our case, well, probably around the world, we're under testing children. So we're only testing children when there's a positive case in a school. There's no exact, and that's my number one criticism of the government's strategy, is to test only symptomatic cases. And there's no like rapid testing being used for asymptomatic cases, especially in schools, unfortunately. And the more, like, if you, there's Dr. Zoe Hyde, I think, from Australia, that keeps saying, if you look for cases in children, you'll find them. So I'm of the same opinion, as when you start testing, oh, what do you know? There's cases.
Yeah.
And in young children as well.
Have you experienced a lot of pushback for your work? Because I personally know how volatile data reporting can be for schools.
Well, when I got started, I have two daughters and they go to high school. And when I got started, it was because the government, during the pandemic, starting in March, closed all the schools in Quebec, but they decided to open them as a test outside of the region of Montreal in May. And so I was very curious, because I live in Montreal, so my kids were not in school, but they were never reporting any cases in schools during that period from May to June. So when my kids got to go back to school in August, end of August, beginning of September, I said, well, I want to see this data. I don't want my kid, I want to understand the risk level in those schools, what the measures are being, the sanitary measures are taking place. And so I started to collect that data for myself. I started to look at media reports, and then some unions were sending me data, and then it snowballed. And then what happened is that the government was still not reporting any cases. So my site became the place to get all of the data for the province of Quebec for all schools for almost 3-4 weeks. And to a point where the media put so much pressure on the government that they actually came out with a list that was similar to mine, but that had 2/3 of the schools that were missing and all sorts of errors. So they had to retract their list, which was a big, like, this is all documented in the media. So it was all a media kerfuffle, because the single guy from Montreal, the parent in his basement, is able to do what the government can't do, which is probably what you're doing with your organization across the states. And it's not that complicated. I mean, it's crowdsourcing. So people send me letters. What they did in Quebec is that the Ministry of Education decided that he was going to mandate all of the schools to send a letter to the parents when there was a positive case in the school. So I said, aha, this is how I'm going to get my data. I'm just going to ask parents or teachers to send me those letters. And that way it's not fake data, it's confirmed data. It's very manual intensive data collection, but at least the credibility of my site went up in seconds, because people knew it was reliable data. It was not fake letters and so, yeah, I had tons of pushback. Then the government was challenged to say, well, this guy in his basement is doing it. What are your army of people working for the government doing about it? And so at the end of the day, they put an army, and they were able to produce us. Now they're producing a site that has daily statistics on schools, but it doesn't have the
I looked at
it.
It wasn't that great. I tried to dig into it a little bit, and I was like, okay, this seems to be missing a lot of vital, pieces of information.
You looked at the government portion of it?
Yeah. For Quebec, or are you talking about Quebec or just Montreal?
Yeah, Quebec.
Yeah. Unless there's another site that's buried somewhere on their website. Because I just Googled, COVID-19 school reporting in Quebec. It was taken to kind of their main page, and it said, click here for schools. And then it gave me a PDF list.
There you go. So
of the schools, and then a color. And I was like, what is this?
So that was the running gag, is that they were coming out with a PDF which was being erased, and they were taking stuff in and out, and so nobody could follow what the heck they were doing with it. And so now I think they gave up the PDF, and they have another version which is more.
Oh, they definitely still have the PDF.
Do they? Okay, well, so
I just found it, and I was like, this takes me back.
So,
I'm still having to scrape PDFs in Florida to get data.
I was doing that
So
at the beginning. I was just converting the PDF to Excel, then I was pumping the data. Then I said, no, I don't want, because at the beginning I got caught in, okay, the government's trying to do this, so I need their data to put on my website. And then of course, when I found they had 50% of errors in their data, I completely, I stopped my website and I told people, you're gonna see my count go down for a few days because I'm just putting this in the garbage, and I want to continue only crowdsourcing my data. I'm not even looking at what they're doing. I don't care if I'm missing information, if I don't have enough, at least I know my data is reliable. And I stuck to that since then. So so I had a lot of pushback, lots of media coverage, either locally, Montreal, province wise, or across Canada as well.
have you had to deal with any threats or,
Yep.
risk to your safety? Can you
Yeah.
describe some of that?
Yeah, well, the people that you were describing earlier, the people that are anti-mask, anti-this and that, we call them in French complotistes. Like they see a scheme everywhere, or they see so they're anti
The
everything.
complices?
Complotistes, yeah. So they started to attack me on social media. There was death threats. I sent them. I didn't take them seriously, but I still reported them to the police. But I mean, at the end of the day, I just ignored them and blocked whoever was trying to diminish my activities. And at the end, they were not serious. But there's at least 20% of the population in Quebec that is anti everything, anti
Wow,
mask,
only
anti.
20. Consider
Yeah,
yourself
we're like,
lucky.
yeah, I was gonna say, I guess maybe we're lucky. Maybe it's not 50.
Yeah, I mean it's between the 40 and 50 here, if not higher. Um, yeah, that's unfortunate. I'm sorry you've had to deal with that. I obviously, have had a lot of that. And it's even if you just ignore it and block it, sometimes it still gets you. And especially when you have kids.
Yeah.
And that's the really rough part.
Well, that was
Um,
I was nervous that the kids would have kind of a side collateral damage or effect at school, and it was quite the opposite. The school direction and teachers were all behind me, and like the school that my kids go to, they were not hiding anything. They were like they only had, I think, 10 cases in a school of 1,200, 1,300 students. They're very well organized, and they went over and above what the government was asking for in terms. They were taking temperature at the door every day. They put air purifiers in the December period. They're doing more than the customer is asking for.
okay. So let me get to some of the cheesy questions.
Sure.
So I already got when you started working your project. Where do you see your role in this pandemic? Like, who are you in this greater picture?
I would say I am the voice of the parents and teachers that are concerned about COVID in schools. And what started to be a data collection exercise became more of an education portal. So now on Twitter, I'm very, very active on Twitter. I don't have that many followers, but the people that do follow me are like proportionally, they are very, very active. And it's a big community with journalists also. And so I see myself as the voice, I guess, for those people, for all of those parents out there. And I have testimonies to that effect. Like yesterday, I'll tell you a story. There was a lady that wrote to me and said, Mr. Drouin, I know that my school is hiding information from me. What's in your data records? I only see 4 letters and 4 cases, but I know there's more than that. I talked to other parents, and then I gave her some tips, and at the end there was 44 cases in her school. So it was
Wow.
tenfold. It was tenfold. I gave her some tricks on how to get the info from the school management, and it worked. And she got back to me. She said, "Yeah, the answer is 44."
Wow, that's
So
crazy.
so when I hear stories like that, I'm like, oh, this is positive. There was a lady that was actually positive with the variant B117 that wrote to me, and that's how it got started because I broke the news story in the media that the first case in a school in Montreal, in Canada also, and the lady had 3 kids in school, so she caught it, her husband caught it, 3 kids caught it in the matter of about 24 hours, and it was confirmed to be a variant. She had to be retested and a second time to confirm that. and she's saying she was crying. She's like, it hit us. We didn't know how it hit us, but it hit us. It was private school, all the security measures, all the right things were being done in that school, but out of nowhere she was. So anyway, long story short, I see my role. This is my community involvement. This is what I do to help the community, and I'm happy to. I'm very proud of what I do, and I think I'm the voice for a lot of people.
Would you consider yourself a provocateur?
You would say that because but if you ask the government, I am the provocateur. I'm probably on their hit list. because no,
oh,
but
that's not good. That's not, you don't want to
no,
piss off
but
your government.
no, but I'm sure I am, because I am every day. There's a story that I break on my Twitter account around something that they're not, the information that is not being made publicly available, or schools that have an outbreak that has this, considering you saw the PDF, right? They only lists the number
Yeah.
of schools. You have no idea what's happening in each school, the count. Is there an outbreak? Is there a variant? All of these things come to me. So I have this information and I break it every day. And I, of course, I have a network of journalists, reporters helping me. So when that happens, I'm sure I'm not their number one candidate, but you've gone through that through jail, I guess.
Yeah, raided, and then I had
That's
to drive.
just crazy.
I had to drive across the country sick with COVID-19
That's just
to spend 12 hours in jail before they're like, we're not keeping her in jail, and let me go. And it's just, I mean, we called them and we said, look, I'm in Maryland and I am extremely sick. Why don't we wait a few days? I'm not going to run anywhere. And I'll come down then. And they were like, nope, it has to be like tomorrow. You have to be here tomorrow. And I was so sick. I was like in a fever spell for several days where I didn't know where I was or what time it was or anything. And yeah, so, I mean, it's all over now, but the lengths that my governor went to try to silence myself and other scientists are morally reprehensible.
Yeah, to say the least.
Unfortunately.
But it's probably a service that he did you, because look at where you are now and look at the influence that you've, and the people that, I mean, think of all the people in the United States you've been able to help with providing visibility to this data. Like it's incredible. So
yeah, it's an odd silver lining. I mean, I had, I think like 70,000 Twitter followers before that happened. So I was already, getting a lot of information out. And then it just shot up to like 360,000 within a few days. And I was just like flabbergasted. And it's strange because I feel like I should do something with it. I have this opportunity, I have this influence, which is why I'm organizing this, because there are a million people who are like you, who basically are running what we started at the COVID Monitor, last year. And there are people like I was back in May before I got fired, who are government and public service employees who are doing all the work that their, mayor or governor or whatever is taking credit for, and never get praise and recognition. And all of those, that wide range of, voices has really been the most important thing during this time. And so that's why I've kind of, taken this up and looking around, and you've obviously got enough people that support you that you've been nominated multiple times.
Oh, really? Multiple times? Wow.
Yeah, and my interest was obviously piqued because I started looking at what you're doing. I don't interview everybody. I'll probably do 50, I think, in the end, and we have to narrow that pool down to 20. So how exhausted are you right now?
Well, I do have a full-time job. As I told you, I'm a vice president for Morneau Chappelle, which is kind of a health and a pension management. And we have a lot of business in the US, actually. So that's what I do for a living. But then I have 2 kids and managing the website. So yeah, I'm exhausted. Somebody asked me, like a reporter asked me at some point, how many hours did you put in there? And I think I'm about to reach 1,000, but probably more.
I didn't even bother counting. after a few months.
No, I just did an
And
average. I'm
eventually
like,
you're just kind of like, well, how many did I do per day? And then you multiply that times the days, and
exactly,
then
exactly.
you realize it's like a second job, or 2 second jobs.
It's
And
probably
it's
2-second jobs, yeah.
yeah.
Or it actually it starts impeding with your real job. So I'm on Twitter all the time, and I'm on, so like I have 5 screens open, and I have my
Yeah.
job, and
Oh,
I'm
you
on
saw my
Zoom.
computer setup right here. You did, I know.
So I'm on Zoom
um,
with my real job, and then I have, if I'm not hosting a meeting and I'm attending, I'm triple at tasking, and I'm doing all sorts of things.
yeah. So, okay, my last question is, what are your plans for after COVID?
Great question. As I think I hinted earlier, I see this morphing or transforming into more of an education portal. So I'm very interested in the school system in Quebec, not just for my kids, but I've been involved in the school community for the last 11 years in all sorts of fashion. I've done politics as well. So I see myself continuing to help the issues around school. Definitely COVID's not going anywhere, so I'm going to continue doing that. I don't know if it's going to take the form of the website that's going to continue, but the Twitter account and the Facebook and the presence and the media is going to continue for sure as being an advocate for anything around school. So there's already a project. I launched a project this week, which is basically to co-construct a book. So I'm writing a book about the future of education in Quebec, and I'm having my followers write it with me. So I put it out there as almost an empty page on Google Docs, and I said, let's start to write a book, and let's just collect all of ideas, our ideas together on what we see the education system, because the education system in Quebec was flawed, and there's lots of issues. And I mean, for maybe 3 months, every day I was talking about air purifiers and ventilation and air quality in schools, and it's just horrible. And I'm part of several networks. One of them is called COVID Stop, and they're medical experts into ventilation, and we've proven how bad the air quality is in school, and that's not going anywhere. And it was there before COVID, and it's going to be there after. So I think we need to act, and we're going to continue to advocate for clean air in schools, regardless of COVID.
For improving ventilation systems in schools, school. And for some reason in the United States, acknowledging that COVID is airborne has been an issue of controversy. So we told schools that as long as you have a sanitizer wipe, you can wipe down all your desks and then people won't catch it. Or we built little plastic cages and then put kids in them to learn, because this is somehow a better experience than being home and being on the computer. And little plastic, visors doesn't do anything when you have an airborne virus.
It actually makes it work. It makes it worse because it creates small bubbles on top of those cages of aerosol.
And it's just the amount of money that's been wasted on those types of measures relative to the needs of upgrading ventilation systems that schools are unable to address in this country has been a very difficult argument. It's really cheap to just put up plastic visors.
Yep.
Upgrading ventilation is extremely expensive.
The same thing here, and I've been speaking to people across Canada and in France. There's a group like me and you in France called the Écoles Oubliées, and I've been talking to them also frequently, and they have the exact same issue. So the fact that getting their government to recognize that COVID is airborne, and then in our case, they just did maybe a few weeks, maybe a few months ago, but just they mentioned the words, but they didn't do anything about it. So they went to the point. It was like we've been talking to folks in the States, all for Joseph Allen and to Jimenez, what's his first name, from the University of Colorado. Like he's like the
Do you know
key.
Kimberly Prather?
Yeah. I mean, we've been in contact with a lot of those folks, and the folks in Quebec actually went as far as to say that air purifiers were dangerous and that we're going to transmit COVID if we install them in schools. So that nobody in the world actually understands this statement, but there were paid scientists from the Quebec Health Organization that actually put that in writing, and then the political arm actually used that to say, well, it's dangerous, so we're not going to do anything about it.
Oh man. I think we're all going to write books about, in the end, about how mishandled this COVID experience was on so many fronts. There really should be like a master book of everything that we did wrong, so that, you know, next time, in 100 years, when something much worse comes around, they can read it and be like, we should not do any of these terrible things that did not work for these people. Kind of like we should have with 1918 and 19, but, you know, didn't do. But thank you for your time, especially because it's last second, and I just kind of wanted to pick your brain a bit about the trends that you're seeing.
It's a pleasure. As I wrote to you, I'm a big fan, so
Awesome.
continue
All
what you're
right.
doing.